you ever been trying to check your patient's blood pressure and the cuff is just like spinning, 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 recycling? Like it's clearly not checking the patient's blood pressure. And I swear this always happens at a time where you're like, you know, something's up with your patient and you need that blood pressure. Well, I'm here to tell you a lot of times, if you know something's up with your patient, you're trying to get that blood pressure reading and it keeps cycling and cycling and it's not actually reading it, your patient's blood pressure is probably super low. Of course, this could be a technical error on the machine side. However, if your patient is matching the picture of having a low blood pressure, I would trust that that machine is trying to do its best job, and we maybe need to grab a manual blood pressure or begin escalating things. Another way you can tell if your patient has a low blood pressure is by putting a pulse ox on their finger. Most likely, if your patient's kind of experiencing some symptoms, you're already doing this, but look at the pulse ox pleth. In order to get a pulse ox pleth, you need to have perfusion, aka your patient's blood pressure needs to be at a high enough level for that pulse ox to pick up. And yes, sometimes pulse oxes don't pick up for other reasons, but if your blood pressure machine's not picking up a blood pressure, your pulse ox is not picking up a pulse ox pleth, your patient's blood pressure, I could almost guarantee, is probably low.